The next part I'm going to talk to you about is the vaccination programs. So there are lots of different vaccination programs depending on what country you live in, depending on what age you are, and you know this because you've been injected plenty of times over your whole childhood. It stops a little bit now. So once you're past year 10, we go with a yearly flu shot in Australia, and then in addition to a yearly flu shot, you might need to get a pertussis or a whooping cough or a tetanus every 10 years or so, just to make sure that you've got a production of those antibodies quite high. Especially if you get pregnant. When you get pregnant, they make sure that you get a flu shot, and they make sure that you get a whooping cough vaccine as well, because pertussis and whooping cough in babies is deadly. In an adult, it's a bit annoying. It's just like a bad cough, but in a baby, it will kill the baby. So that's why it's really, really important for pregnant women, their partners, and their entire family. Anyone who's going to be anywhere near a baby for the first 6 weeks of their life should have this, the whooping cough vaccine. So vaccination programs, and we need to talk about this second part. There'll be another video on herd immunity for any particular disease. So I'm going to link to this. It's a really good video. We'll watch it in class. It's a little bit of a summary of what vaccination programs are and what herd immunity is. But other than that, let's just move on. So the primary goal of a vaccination program. What we want to do with a vaccination program is we want to decrease the incidence of a disease. This is why we don't have smallpox. We don't have smallpox. We don't have polio in Australia because of vaccination programs. And that's why you end up with this ultimate eradication. And so there you go, polio and smallpox. So that is our goal of a vaccination program. Here is a really blurry copy of a vaccination schedule. What you've got here is it says childhood, and it says adolescence, and it says adults up the top. And there are different vaccines that you need at different ages. I've got some better pictures here, and I might show you some in the class, or I'll link to some. But the vaccination schedules differ by state, just slightly, and they differ by country, definitely, because different countries have different diseases prevalent in them. Yes, we're a global world, and that's what we've just discovered, but there are different vaccination programs for different states. So I'm just going to pause and see if I can pull up a better copy of one of these. Here we go. Let's have a look at the immunisation schedule that we have here in Victoria. So this is our vaccination program. So at birth, literally within 24 hours of birth, you get injected with two things. You get injected with vitamin K, and you get injected with hepatitis B. Now, vitamin K is not a vaccine. Vitamin K is just to supplement the fact that there's a bit of a depletion straight after birth, but hepatitis B you can give straight after birth, and you can give it up to 7 days after birth. Then at about 6 weeks, you go through your next one, and you get this, what we call the hexa vaccine. And it's got hexa, meaning 6, so diphtheria, tetanus, pertussis, poliomyelitis, so you still get a polio vaccine, hepatitis B, and haemophilus influenzae type B. It's not the flu, but it is a type of vaccine. And you can see that it's telling you where it's given. So it's given in the thigh, and it's given via an injection. Pneumococcal as well, you get, so that at 6 weeks old, they get 2 shots, and then they get this, there's one that's given via the mouth, so it's an oral one, and it's a rotavirus one. So rotavirus causes gastrointestinal problems and like gastro symptoms. So you don't want to get rotavirus. It's not particularly nice. Then at 4 months, you get the same thing again. You get all these 3. Then at 6 months, you get another lot. From 6 months old, you can get your flu shot. Then at 12 months, you start to get others. You start to get your MMR vaccine, which you might have heard of before. You get a meningococcal vaccine, and you get another pneumococcal. Depending on whether or not you were premature, you might need another hepatitis B. So you can see how detailed this schedule is. 18 months, you get another MMR. So you can see you're constantly getting shots for the first year and a half of your life, and then there's a bit of a break. And we go to 4 years old, and you get this diphtheria, tetanus, pertussis, which is that whooping cough that I talked about. And then from 5 onwards, you get a bit more. Then we go to adolescence. So this is in year 7. You get Gardasil and you get a Boostrix, which is another diphtheria, tetanus, and pertussis. At year 10, you got meningococcal, or if you didn't, you can go and get it now. That's not a problem. And the flu vaccines. Then you can see right down here, here's your adult one. If you are Aboriginal or Torres Strait Islander descent with a medical risk factor, so there are medical risk factors, you need to see your doctor to ask about that. You need to get pneumococcal, but you also get influenza and hepatitis B. Pregnant women get the flu and the diphtheria, tetanus, pertussis. You can see all of these different ones here. And that is our immunisation schedule in Victoria. There are also other groups. So we've got vulnerable ones where a women planning pregnancy, if you don't have sufficient rubella antibodies in your system, so they'll do a blood test before you get pregnant, and then if you're planning on getting pregnant, and what they do is they test to see what your rubella levels are in your body, and if they're too low, then you might need another vaccine. But you can see we've got a lot of different vaccines that are present for different risk groups in the population. And that just doesn't mean that they're going to get it being in a risk group. It just means that the incidence is slightly larger in that subgroup of the population. So therefore we can give them a little bit more of a boost by giving them a booster.